Good evening, everybody. I'm Maryn McKenna. I'm a journalist and author and faculty in the Center for the Study of Human Health at Emory University. I'm your host tonight of the Emory Center and College's author Q&A series. I'm so glad that you're here. In addition to the Center for the Study of Human Health, this series is sponsored by the Georgia Center for the Book, and we are so grateful for their support. Tonight's our last Q&A of the fall semester, and I am here with Olivia Campbell, a journalist and author based in Pennsylvania, author of the fantastic book, Women in White Coats: How the First Women Doctors Changed the World of Medicine, which was published in March by Park Row, which is a division of HarperCollins. Is that right? So thanks, Olivia, for being here. For those of you who've attended before, you'll know how this goes, but let me explain for everyone else. This is a Zoom webinar, as opposed to the calls that you're all probably still spending most of your days on. The fact that it's a webinar means that we won't see you on screen. You only get to look at the two of us. You are welcome to ask questions at any time through the Q&A portal at the bottom of your screen, and I will relay those questions to Olivia. We will begin voicing those audience questions out loud about halfway through this hour-long conversation. For the first half, it's... Sorry, we just got a chat. Thank you, Joel. So for the first half hour, it's going to be just me asking Olivia questions, and we're going to get started right now. So, Olivia, let's just sort of start with who you are. I know you write for a number of places. This is your first book. Congratulations. Tell us a bit about your professional practice and how you came to do this book.
Well, I have 3 sons. I live outside of Philadelphia. I've been a freelance journalist in the women's health and women's history realm for about 10 years now. I came to do this book. An agent actually approached me and asked if I had any book projects. So it was really someone giving me permission to tell myself, I'm ready to write a book. I'm capable of writing a book now. I was just trying to stay afloat with the freelance writing pieces. But an essay I wrote for a literary hub about climate change and its relationship to literature piqued the interest of several agents, and they reached out to me. I had to pick one of them, and then they said, okay, what books do you have? What book ideas do you have? And so I made a list, and we went through the list and decided which one to do, basically. So, I mean, I've wanted to write a book for a very long time. I was writing Nancy Drew mysteries when I was like 10 years old. So but fan fiction. So writing about women's health, I didn't start that until I finished college. I was an arts writer. I was a ballet dancer in college, and then I broke my foot and started doing arts journalism. And then I got pregnant in college, and that experience of a very difficult childbirth, postpartum depression, started me on the path of writing about women's health. So that's how I got started in women's health, and where I've stayed pretty much, until now.
And had you known about the subjects of this book, the first women who sought medical education in America and Western Europe, right from the start, or did this come as you were writing about other aspects of women's health?
I actually didn't know a lot about them. I've written about various figures in kind of the history of women's health, but these in particular, I didn't really know a lot about until I started. The first thing I read about this, I think it was in Lapham's Quarterly. There's a piece about a riot that happened in Philadelphia, so nearby. So that, I'm very interested in that initially because it's close to me. It's where the women from the Women's Medical College of Pennsylvania, which was one of the first women's medical schools in the US that was founded by men and women who were Quakers. But they kept petitioning the Pennsylvania hospital, so they could attend a clinical lecture there. They've been petitioning for a decade or so. Finally, the school relented and said, okay, you can come, because the male medical students at the colleges in Philadelphia have been attending these lectures all the time. So they finally let the women in, and the men found out about it beforehand, the male students. And so they were passing around this note that said, come see the she doctors. So when the women appeared in the amphitheater, there's 300 men instead of maybe 100 would normally attend a lecture like this. And so they're throwing spitballs and spitting tobacco on the women. They're catcalling them. They're screaming epithets. They're stomping their feet and hissing. So that was my kind of introduction into this world of women trying to get medical degrees in the Victorian era. And I just was blown away. And very soon after that, I read about the Surgeons' Hall riot, which was almost exactly a year later in 1870. And it was essentially the exact same thing, where women are going to an exam for medical school, and it was going to be men and women taking the exam. And so all these people from the city and from the University of Edinburgh kind of converged in the street and threw a riot about the fact that women were, deciding that they could be doctors. They thought that this was not okay. So they threw mud at them. They threw rotten produce, rotten eggs. They let a loose sheep in the exam room. It was total mayhem. They're chasing them on the way out. They're trying to escape. It was to have those two events be so similar and so close in time. I had to dig more. I said, there's something here, and I need to know more. I have to know everything that these women were going through at this time, just to try to get medical education.
So I'm going to come back to those two riots because they're just such extraordinary stories. And I think it's important to be reminded right at the start of this conversation that opposition to women seeking medical education was not just a matter of people writing letters to the editor, that it in fact was aggressive and violent, and in some cases dangerous, and certainly was intended to be extremely intimidating. So we should keep that in mind. But in order to set the stage, I think we should talk first about the status of women's health at the time. We're talking about the start of the Victorian era, I guess. So back in the 19th century. And people might assume that since women didn't go to doctors that much, that women were quite healthy. But in fact, you make the point several times that women were not in fact healthy, that they were subjected to many practices and expectations that really undermined their health, and they didn't really have anywhere to go with that. So talk to us about that a bit.
So there wasn't a lot of, research. Doctors weren't interested in learning the real reasons why women got sick. And they definitely got sick more often than men, I would say. So many of the women who I read about who decided they wanted to become doctors did so because they had a female relative that was constantly sick, that was, constantly pregnant and constantly sick because she was constantly pregnant, who had died in childbirth, who had, lost a child in childbirth. All these things were major reasons why women suddenly decided, okay, I have to do something. I have to change this because women are getting sick more often, and they're staying sick because they don't want to go to the doctor, or they know that if they go to the doctor, there isn't a whole lot that they can do for them there because they're not interested in doing the research to find out what is really causing these problems. At the time, it was kind of assumed that because you had a uterus, that's why you were sick. Like just the fact of your uterus itself, it means the ancient Greek idea of the wandering uterus, like it's choking you, it's suffocating you, right? So that kind of carried over, not that exactly, but it that kind of was definitely influencing the Victorian thinking about women's health in general. Cancer was thought to be like a feminine ill, like they thought men who got cancer had been feminized. So these women, they didn't want to talk to their doctors about some of the more delicate problems they were having, right? And second of all, when they did go talk to them, a lot of times the treatment was more uncomfortable. The treatment was possibly a medicine that was, toxic, that was poisoning them anyway. They were still bleeding and using leeches at the time. Still humorism is still around when Elizabeth Blackwell comes on the scene here. She's kind of the last of that old school of medicine, but yeah, it was kind of a nightmare to be a woman at the time. They really didn't want to think about how, well, maybe your restrictive clothing is why women are getting sick all the time. There's really heavy skirts. Maybe that's it. Maybe, you know, it's really dangerous to be a woman as a domestic worker, right? It's dangerous to be a woman working in a factory. These things, they didn't want to think about that. They just wanted to say, oh, you have a uterus, and that, you know, there's not much I can do for you because of that.
Right. So we should underline that this is actually just before the achievement of germ theory, right? Before Robert Koch, we're talking about, which is what, 1848, is that right? His Koch's postulates, or maybe it's 1842. So there's no understanding of what causes disease. There's no reliable birth control except for abortion, which might or might not be reliable. So women are being pregnant or recovering from pregnancy most of their adult lives. They're running very large domestic operations, often without health. Their nutrition may not be good. They may be living in cities that not yet have had the sanitary revolution and may not have sewage. So all in all, it's a very unhealthy place to be, is the early Victorian era. And then add to that men are uninterested in the delicate problems of women, as you say, that it just seems like it would have been a desperate situation.
They also weren't encouraged to exercise as much. Like in elementary schools, you have boys going out and running around, while the girls would stay in and be sewing. And, you know, that wasn't proper for girls or women to be roughhousing, to be, you know, doing sports. So there's just thing upon thing upon thing. You're stuck inside, you're sitting all the time. So these first women doctors kind of saw this whole picture that, you know, male doctors couldn't see how different their lives were from men, and that, you know, this to them was obvious as to why they were getting sick more often.
Right. To be a woman was to be in an unhealthy condition, or to be in a place where all of the things that impinged on your existence would be unhealthy for you. And then on the other hand, what's so interesting to me about this is that at the time at which women decide, these few brave women whom we're going to talk about, decide that this is ridiculous, we need to seek medical education for our own personal and professional goals and to enhance the health of womankind generally, medical education itself is not what we would think of today. So this is before American medical education gets reorganized at the beginning of the 20th century. There's a lot of different kinds of sort of medical schools and medical colleges and colleges of apothecaries and colleges of surgery. And while they're not united in any way, except maybe their opposition to women, the fact that it's so multifarious maybe inadvertently presented some opportunities. But maybe we should start first with just how what a mess medical education was.
I was shocked. I could not believe how little education it took to call yourself a doctor in America. And in Europe, it seemed significantly better in this time period I was researching. You needed many more years and many more exams and much more training in general in Europe. So yes, in America, it was a total hodgepodge. I think the year that Elizabeth Blackwell started school was, I think it was the year the American Medical Association was born. And that was like, they had just decided that medical education needed to be like 2 years instead of like 6 months or something ridiculous like that. So it was, yeah, I would not have wanted to live at this time at all. These doctors had no training, not to mention that even after they went up to 2 years, a lot of these men would appear at a childbirth having never seen, you know, a real childbirth before in their lives. They had no actual patient experience. They'd just been reading books. It was terrible. But yes, there's all kinds of different sects at the time. There's like hydrotherapy, there's mesmerism, there's, you know, people, this is when doctors kind of started having less and less time for their patients. And so this is the same as it is now. People were being drawn to alternative medicines. And Elizabeth Blackwell was very clear that that's not what she wanted. She had to go to regular medical school to get a regular degree to kind of pave that path for other women. But there was that urge. There was other people telling her, well, if you can't get into regular medical school, you should just go train in one of these other disciplines. You know, you could practice medicine. You won't have an MD. You won't be like official, but you can still practice. People like Harriet Hunt, who came before her, she, you know, was constantly begging Harvard to let her in, but they were always like, no, you can't come. But she had a medical practice. I think she was into like homeotherapy and maybe a little bit of psychology and hydrotherapy. But she was kind of the predecessor to Elizabeth Blackwell's first MD.
So we should acknowledge that women probably always practiced medicine in some form. They just weren't allowed to call it that. As you say in your prologue, that there not only were there women who practiced medicine in the classical era, but there also were for hundreds of years women healers, women wise women, people who would have been applying sort of what we now think of as ethnobotanical knowledge and indigenous knowledge, that were the people who actually took care of most of the everyday health of the cities or towns and villages where they lived. But they were denied the status of being thought of as a doctor when we get to the point where doctors actually have status. And they, in some cases, were sort of actively militated against by society and particularly by the church.
Yes, women have always been healers, have always practiced medicine. Ancient Egypt, ancient Greece, women have always been midwives for sure. In medieval kind of era, you have whole families would be like practicing, their household would be have a job, right? So like everyone in the household would be participating in the patriarch's job, basically. So if he's out on a visit, the wife might be pulling teeth, right? So and once you get further along, the wives were expected to know how to make medicine. So as you look at all these early modern recipe books, and you have recipes for stews and you have recipes for medicines in the same book, because you had to know both of these things. You were practicing medicine on your relatives and possibly even people in your communities, especially for the wealthier women. That was kind of expected of you to give back to your community in that way. To maybe you would maybe have your servants mixing it, themselves. It wouldn't be you making it, but you would know how to do that. You would be growing the herbs, and you would be, practiced at that. So it's really just changing where medicine is taking place. Really, we have medicine happening. The first sort of hospitals you have are convents and monasteries. So you have nuns and monks practicing medicine on community members, on soldiers that are wounded. So yes, then as soon as the church and other people decided that, you need a university degree to call yourself a doctor now. It's going to be an official thing. It's going to be licensed. I mean, this is good, right? We want there to be licensure. We want there to be a way for people to say, okay, this person is charlatan. They're kind of, pulling the wool over my eyes. That they don't know what they're talking about. We want there to be able to be a way to say, okay, this is an official doctor, right? So that is good, but the fact that they chose to drive out all these lay women healers, calling them witches, saying that only God can heal people and God would never let a woman have such power. So they must be from the devil. You must be a witch. They killed thousands of people, accusing them of witchcraft, but they were actually just herbalists and healers for the communities. That's how scared they were of this knowledge. And if you kind of compare and contrast what knowledge these men had when they graduated, this book learning of medicine, versus these women that had, decades and decades of herbal knowledge passed on from their mother and their mother before them. If you think about who you'd rather be, who would you rather have as your doctor? Of course, you're going to pick that woman who actually knows what she's doing. She's seen patients, right? But that's, they had to get rid of them. They could not have the competition. They had to say, no, women are allowed in universities, so only men can be doctors, the end.
So that's the literal centuries of pushback that these women who seek medical education in the 19th century are up against. So let's start talking about some of their stories. You mentioned Elizabeth Blackwell. She's the one that is the first major character in your book, and really the first one to kind of step out of line and say, no, this is really what a woman should do. So tell us about her.
She is definitely probably the best known of the three main characters in this country anyway. The first woman MD in America. I find her to be a very odd person from my research. She was very interested in not necessarily celebrity, I don't want to say, but like she really wanted to be known as the first. I think when her sister was interested in being a doctor. I think she was almost kind of threatened by that because she wanted to be, you know, the celebrity. But no, I think she really did care about elevating women and women's medicine. She wanted to find out, you know, what was going on, why women were so sick. It was her neighbor having cancer that prompted her to become a doctor in the first place. She was really worried that she was going to find it disgusting. She was going to be revolted by seeing, you know, the insides of a body or dealing with the more disgusting things that come with treating patients. But the first time she did a dissection, she was overwhelmed by how beautiful it was to her. So I really enjoyed that revelation from her, that she was really worried she would kind of embody that stereotype of, you know, she couldn't handle it. And then she, you know, finally when she was confronted with it, she was just the exact opposite. She thought it was exquisite, the inner workings of the human body. So I really appreciated that. She had a really hard time getting accepted into school, but once she got into a school, she didn't have a lot of problems with harassment. There was a few little times that people would like throw something at her, or like one of the professors asked her not to come to a class, and she was like, no, she put a stop to that like immediately. She was very stern, and you know, determined, so determined. But she finally earns her degree, and then she doesn't have family money, right? Her father had passed away, leaving the penniless, and she had to work for many years as a teacher just to earn enough money to go to medical school. So when she finally gets her degree and she tries to go get a job, no one will give her a job because they don't want to employ a woman physician. That's not a thing. So she opens her own practice. Well, no one wants to come to a woman physician either, because a woman doctor at this time is an abortionist. And so everyone thinks that's the only thing she practices. Well, that's not really it. So she decides she's going to do some lectures to kind of drum up some business. So she starts speaking to the local community about how she thinks girls should be taught like physical education in schools just as much as boys. She preaches prevention. She's really an amazing forerunner of preventative medicine. Like, this was not a thing that doctors taught at the time, but she wanted to teach mothers and families about how to keep a clean house, how to have open windows, airflow, eating well, these things. Like, she was very suspicious of medicine, and I think that rightfully so. That she kind of saw these medicines could slowly poison people, and she was like, okay, well, let's try to prevent you from getting to that point where you need that poison medicine, right? So this plan worked, and she finally got some patients, and she wasn't rationing her coal for her fire at her practice anymore. But she takes this lecture tour over to Europe, and then is lecturing women about how incredible it is to have a career, and how they should join her in this. she's kind of alone at this point. She wants to inspire other women to follow along her path.
So it's really amazing to me that as the first woman who steps forward and tries this, and she gets many turndowns, as you say, she eventually is admitted to a medical school in upstate New York. But it's kind of as a fluke. Like, they don't, when her application comes in, as you describe in the book, the student body has to vote on it, and the student body, who are of course all male, think that what this is actually a prank being played on them by the student body of another medical school. And so they say, haha, of course we can have this, we'll admit this woman. And then she actually shows up. That must have been a shock. But it turned out that it was not that she had it easy by any means, as you described. Once she got that hard-earned degree, she had a great deal of trouble practicing. She had to leave the country. She went to and studied in Paris for a while. But the women who came after her, including two of your main characters and other women beside, it's as though medical education realized they'd made that one mistake, and they determined to make it harder for any woman coming after her.
Every time these women like snuck through a door, it was firmly slammed behind them. So Elizabeth Blackwell graduates from Geneva College, and they refuse to admit any other women after that. They're like, this is too much negative attention on us. We didn't like it. We can't deal with this anymore. So no more women. When the next one I talk about, Elizabeth Garrett, when she got her licensure through the Society of Apothecaries, they immediately after that closed this loophole that had language that included women, that didn't, I guess it didn't specifically say men only, basically, is what got her through there. Like they couldn't, of their charter didn't say men only, like most other universities that said, only men are allowed in here. This one didn't. And so they had to immediately change that language to say, oh no, this is for men only. So every time, they find a little way through, they close that door right after, so no one else can get through it.
So, but I want to remind the audience that we are going to take questions from you for Olivia when we get just a little bit further along. So if you have any, please just type them into the Q&A box and I will make sure that everybody hears them and we will answer them. But for now, I'm going to ask some more questions first. So you talk about Elizabeth Blackwell, later on her younger sister, Emily, Lizzie Elizabeth, another Elizabeth, Lizzie Garrett from the UK, Sophia Jex, and some other heroes as well, who are heroines who eventually band together and sort of make a kind of like a flying wedge for women who come after them. But all of this, I think, was very, even though they had that companionship of each other to some degree, this must have been very hard on all of them. Can you see in their stories the strain that this took?
Yes, there's a moment when I talk about I think it's Ann Preston from the Women's Medical College of Pennsylvania. She was the dean there, and she knows Elizabeth Blackwell also. And Elizabeth Blackwell is just having a terrible time at one point, and she's not sure she can go on. And there's a snowstorm in New York, and Ann Preston just happens to be in town, and she comes to visit Elizabeth. And like Elizabeth talks about how this just injection of energy of someone younger than her, who's like got a little bit more life left in her or something, just it's closer to the beginning of her path, I guess, is what it is. Seeing this woman really ignited her passion over again. So that spark of sisterhood, of companionship, really is what the fuel that kept everyone going at this time. It was very lonely for everyone involved, because most of the time, if you did get into a school, you were the only woman for sure. And the men were probably merciless to you, and the school might have even been merciless to you as well. And these women, so many of them lost their family support also, so they had to rely on each other. They had to have this companionship of other women that were doing what they were doing. No one else really understood what it was like unless you were in the thick of it as well. People, their parents just kind of abandoned them, essentially. There were stories of when there's one woman who she had to wait for her father to die before she could go to medical school. That's how against it he was. All three of her brothers were doctors, but she wasn't allowed to go to medical school. Another woman, her mother said she'd rather see her daughter in an insane asylum than in medical school. So this isn't just like society, poo-pooing your dreams. This is like all of your family being like, what are you doing with your life? No one's ever going to ask you to marry them. This is just killing your chances of having any kind of a life. So there were women who were disowned for these choices. There were women who did not have any financial support, even if their family was rich. They were cut off from any of that help. So this was not a cool decision. This was not an easy path at all. So those, yes, those friendships among these women were vital. So we should be clear, to go back to the things we began talking about, that this opposition was not just a question of, we're not going to let you apply to our medical school, but if you eventually wear us down, we might let you in somewhere. After these women were in school, the opposition to them was in some cases violent. In other cases, there was sort of a subterfuge that undermined them. And in some cases they were admitted and then they were chucked out. And this all just sounds both terrifying and heartbreaking. It's, yes, for Lizzie Garrett and Sophia Jex Blake, they had a terrible time. So Lizzie Garrett had finally kind of convinced her father to allow her to go on this path. And he was, by the end of her getting her licensure, he was quite the convert. He was really a fan. He was really an advocate of her. He cried the most when she got married because he worked so hard for her to get this profession, and now he's worried she's throwing it all away. But yeah, so the way it's set up in England is almost all medical schools are attached to hospitals. So she would go into a hospital to be like a trainee nurse. And then she would be like, hey, can I take this class over here while, on my off hours? And they'd be like, okay, sure. And then she'd be like, hey, can I take this other class too? And so finally they would get wise to what she was doing and kick her out. So this happened several times. She would be like, finally get a few credits under her belt. And they'd be like, oh, you need to get out of here. One time it was the students getting angry because she had submitted a case to a medical journal, and she had gotten, she discovered this thing and it was right. And it was an interesting case. And I think it was the Lancet, I think they published it. And so everyone was like, oh, she shouldn't be allowed to do that. They were just jealous. They were mad that she was smarter than they were. So she goes around to different schools and does the same thing, where she cobbles together all she needs to get licensed by the Society of Apothecaries. She has to do a few like private classes with some of the professors or employees from these hospitals that kind of take pity on her, or see, they really see her potential and see how dedicated she is, and see that she's not, just like snooping around for a husband, or, she really wants to do this. She's good at this. And she's more interested than a lot of these men. Medicine was not something like it wasn't the really venerated profession that it is today. So just, I would say maybe this is around the time when it starts becoming more civilized in the medical students realm. But yeah, these were some rough and tumble guys. These were, they would be going out drinking all the time. You became a doctor if you couldn't be a lawyer or something better, basically. So these were not the best class of men we're dealing with at the time. So that was also really surprising to me. So she finally gets licensure. So poor Sophia Jex Blake, oh my gosh, she goes to the University of Edinburgh and she says, I want to take a couple of classes in the medical school. And they're like, oh, no, we can't do that. It would be too expensive because we'd have to do a totally separate class for women only. And she's like, okay. So she goes to the editor at the Scotsman, and he's like, okay, well, let's do a little ad in the paper to say if anyone else wants to join you at the school, surely if, there's more than one person, they have a reason to spend this money, right? It's going to be more affordable if there's more people. They can't turn me away because I'm just one person. So it works. Is she gets 6 more women to come up and join her at Edinburgh, and they finally, they realize they have to relent, because they told her the reason in the first place was that she was just one person and they couldn't afford separate classes. So basically they just kind of throw them the textbooks they need for each class. They say they don't require them to teach them, but they have to provide, all they need for classes, but they don't have to provide them with a professor, basically. So there's a few classes at this kind of like not like a secondary school, but like an adjacent, one of the colleges at the university, basically, where the professors are like, oh, hey, you can come take our class here. That's fine. You can be with the men. They actually found out that when the women were there in classes with men, that the men behaved better when the women were there, which is, it's not what you want. It's not a good reason. We still have this problem today with girls sitting, being placed in seats by boys because they keep them in check. Well, that's not okay. That's a separate topic. So his 7 women, some of them drop out at some point, but other women have joined along the way. So all 4 years at their university, all of the women that are there at the end, they've all done everything they need to have a medical degree. The same degree as the men would. It's totally the same classes. They've done everything they need to do, all the internships, everything. And the university is like, oh no, we're not going to give you your degree. It's not. Like the whole time they were there, antagonizing the professors, antagonize them. The professor's assistants antagonize them. They got in public arguments about the antagonizing. They were like publishing fighting papers and medical journals and newspapers about the antagonizing. And they said, no, we're not going to do it. We don't have to give you a degree, even though you've earned it.
The role of
So
the medical journals was really shocking to me, that both two journals that we think of now as leaders in the field, the Lancet and what's now the BMJ, the British Medical Journal, both editorialize against having women in medical school and denounce the women who are already in medical school and say they should be removed.
Yes, the number of like famous men, like men whose names we remember now in the history of medicine, or were like some of the biggest people that were against this. I was shocked. Like I don't like reading, biographies of theirs. There's statues of them. There's plaques to these men, and one of their, to me, one of the major things that I remember them for is that they refused to allow women at the medical school. They fought and screamed about it in the Lancet, in the BMJ, and talked about how they couldn't be a part of this medical association or that if the association were to allow women into it. Like that that was the sword they decided to die on. And yet we remember those famous men for their medical breakthroughs, but we don't remember these women for all that they did.
People like Joseph Lister, right? One of the fathers of aseptic surgery. I
Yes.
did not realize that he was such a sexist, and it was disappointing.
Yes. Yeah, it was bad.
So one of the things that's interesting to me, I guess, in every terrible thing, you have to look for the good, is that because so many doors are slammed in their faces, these women go on to open essentially sort of a branch of medicine and also actual physical institutions that cater to women. There are infirmaries for women, hospitals for women and children on both sides of the Atlantic that exist, not just because women are being neglected by mainstream medicine, but also because these women that we're talking about need an outlet for their talents.
All of these institutions were set up with the idea of this is a place for women to be healed and a place for women to train and become doctors and have jobs as doctors. So all these women are, couldn't find a job anywhere else. So they start their own practice. Well, their practice is so busy, they expand into a hospital. This happened to all three of these women separately. Elizabeth Blackwell is in New York. She has a practice, and it expands so much and it gets so big that she opens a hospital. Then she opens a medical college for women attached to that hospital. One of her colleagues, Marie Zakshifa, she goes to Boston and establishes a women's hospital there. And that's where Sophia was inspired to become a doctor. It's also connected. But yeah, and the sort of silver lining, I guess, is that so many of these women were sent to Europe for extended training, right? They couldn't find places to intern, places to get training in the US and in England. So they're going to Paris, they're going to maybe some places in Edinburgh later. They're going to Germany, they're going to Switzerland. So this is where the cutting edge medicine is happening at this time. This is where all the innovation is happening. So after they go to their training, I can't stress how many women went to Europe to get extra training because the degree in America was so, short and it just inadequate in general. So they would come back to America, and they really brought the cutting edge treatment back to America for women, which was, critical. That's the vital point here. We have the first, really the first preventative medicine. We have the first like home social worker kind of visit person at the Blackwell's institution. And Boston, there's the first prenatal care is happening. So when Marie first shows up at the college that's run by a man in Boston, she's asking for all these tools to help her teach. And he's like, well, we're not having those newfangled European instruments here. What do you think we are? So they're really ahead of the curve here in medicine, which is really just incredible. All of these hospitals were constantly turning people away. They were always more people that wanted to be a patient there than they had space for. They were also constantly expanding. In London, Lizzie Garrett's hospital was always expanding to a bigger premises, and there was never enough space for everyone that wanted to deliver their baby there or to get treatment there. It was once they got started, and once women realized what kind of treatment they could get from other women, and the kind of things they could talk to other women about as a physician, it really blew up, and it really took off.
So a thing that's kind of embedded in what you're saying is that we also really can thank these women, not just for creating what we now think of as the specialty of OBGYN, but they really created a large proportion of what we think of now as sort of urban public health. Because as women getting this European training and attending to patients, women and children who were disregarded by the medical establishment of the time, those women came to understand holistically how important it was not just to see women like at the point of delivery or at the point of needing a cancer operation, but for prenatal care, for child nutrition, for sanitation, for sort of arrangement of the home, the whole gamut of what we think of now as being part of building a healthy society is in some ways based on the training that they were forced to get outside the country because American and British medicine didn't think they were good enough.
Exactly. It's like I hate the concept of silver linings, but if ever there was one, this is one for sure. Elizabeth Blackwell's like her whole baby towards the end of her career was sanitation. Like she was all about, she made sure there was a chair of sanitation at her college. She was very into educating the wider public, especially mothers, about how to keep a healthier home, how to keep a healthier environment in general. Yes, it was very cutting edge at the time.
So questions are starting to come in, and I'm going to ask a couple of them now. Audience, thank you all again for listening. I'll remind you that if you have questions for Olivia, just pop them into the Q&A and I will voice them out loud so everybody hears them, and Olivia will answer them. So let's go first to this one, which I think is just fascinating, which is, given what you learned about how women were marginalized, how they were excluded from the power of medical education and medical degrees, and how they had to carve their own path, what kind of lessons can we extract for today as we attempt to make society more equitable to other marginalized groups? And how can we what does it tell us anything about what we ought to think about as we try to open up professional opportunities and medicine and healthcare to other marginalized groups?
That makes me think of how when these women started out, they didn't want to have a separate school. They didn't want there to be just a women's medical school, right? They just wanted to attend the schools that were already there. And I think that can be a big thing, is making the institutions that we already have, equitable and open to marginalized groups in much more than they currently are. So these women, they saw that all the resources and all the professors, and these universities that are already established, they have all the funding, and they have all the museums, and they have access to the hospitals, and they have the laboratory equipment, and they didn't want to build it from the ground up again. They didn't want to be scrounging for parts and pieces just for women. But when they saw how women were treated when they went into these male spaces, they realized that society wasn't ready for them yet. So I think we need to think about how we can make it more, how we can be ready for groups that are marginalized now, how we can be more welcoming, be ready before so they don't feel compelled to go build this whole separate enterprise as a temporary fix, just so they don't have to face harassment
until history catches up.
Right, exactly.
And we should be clear that though you talked about how incredibly successful and appreciated by their communities the hospitals and colleges that were founded by these women were, it wasn't always a guaranteed success. Sophia Jex in particular, right, has she starts a school and then she loses a school to other people.
She's my favorite character. I love her. She is a fat, angry lesbian, and she's got all the fire, and no one understands her, and everything that they disliked about her then is what I love about her now. Sophia is just, she doesn't care what men think of her at all, and she'll say whatever she wants. She was much more interested in things happening right away. Some of the other women were like, oh, it will happen eventually. We need to like do a slow chipping away, keep, slow and steady, really calculating our steps. And, we don't want to step on men's toes because we need them to get to our goal. Right. Well, she didn't care about that. She was like, no, we're going to do it now. And we're going to do it however we want. And I love that. She has some of the best like comeback lines I've ever seen. Her mind is incredible. But it was her idea to found the London School of Medicine for Women, which is ultimately what the book is about, the founding of this school and how these three very different women from all different places come together and found this school. So she was the one who was like, okay, well, I didn't get my degree, so I'll make a school for myself. So she gathers all these people together and says to the two Elizabeths, well, you have to do this with me, or at least have to be incorporated into this in some way, because if you're not, it'll look really bad. Like people will think that you're not condoning it, basically. So because you're the only known MDs in the country of women, you have to be involved in this. So they finally relented, even though they're like, she does not have the personality to have a school. She's totally the wrong person. She's got too much of a hot temper. This is going to be a disaster. So they try to get, wrest control from her. And while she's away in Ireland, finally taking the MD test, the exam to get her certified to practice, because she has all the classes she needs. They basically like vote her out of her own school because she's just not the person they want as the head, and they insert Elizabeth Garrett Anderson instead. And so it's remembered as Elizabeth Garrett Anderson's school when it really is not. So she kind of, Sophia takes her tail between her legs and goes up to Scotland. Again, this is like the second time that she's had her heart broken in London, and she goes off to Scotland. So she founds another school there. She has a little medical practice that also expands into a hospital. And then she starts a school because she's having students from the University of Edinburgh come to her, just as she was a student there before, and say, we're having problems with the school. We can't, get its classes. We're still struggling. This is, a decade later or so. And they're letting them in, but they're not making it easy all over again. So she's like, well, maybe I'll just found a school here too. And all her friends and her former colleagues are like, what are you doing? Why don't you just come back to London and make this other school work? Why are you abandoning this? This is not, why are you starting all over again? But she opens it, and then it's a total disaster because she doesn't have the support she needs. And she has a disagreement with some of the students that are like, I think they're maybe wealthier or something. And they kind of like get angry, and she has to close her school down. So like they start a rival school, and so everyone starts going to this other rival school. So yes, very, very lots of drama.
Well, it sounds like a lesson we know, or we should have learned from Silicon Valley today, right? Which is that founders aren't necessarily good managers, right? There's an energy and a unique entrepreneurial vision to people who start startups, but sometimes the people who start startups shouldn't keep managing the startup afterwards. Right. And it sounds like she was one of those.
Yes. Be the ideas person, not the...
So another audience member wants me to ask you, thinking back to as much as you know now about women's health in the Victorian era, where are we with women's health now? Can we say confidently that women's health is better, not just in the United States, though we should stipulate the United States is not necessarily the healthiest place to be a woman, but around the world? Are we still close to the Victorian status of women's health, or have we managed to get beyond that?
One of my favorite images, I think it was a sketch of a woman getting an exam, and she's standing up and she's folding her arms against the wall. She just has the grumpiest look on her face. And the male doctor is crouching down with his hand under her skirt, and he's like looking the other way. Right. So that's where we're at. Like they weren't allowed to look directly in the vagina like that. They delivered babies under sheets. Like there's a special speculum to deliver leeches to the cervix to bleed the cervix. So yeah, that makes me cringe a lot. But with that said, it is in the back of my mind through promoting this book, writing this book, all of these memoirs that are coming out now and in the past a decade even, of women who've been misdiagnosed for years, women who've had chronic problems and the doctor doesn't catch it, the doctor doesn't care. To say that we've solved women's medicine is totally incorrect for sure. Women are believed to have former pain tolerance. They're still not included in as many clinical trials as needed, especially pregnant women. Yes, brushed off, written off, called hysterical. Still, it's definitely improved from what it was in the Victorian era, for sure. We had these women come in and start doing the research and saying, you know what, it's not going to sap all my bodily energy to go to university. I'll still be able to have children. Like that was the prevailing thought at the time, was that, oh, you can't go to college because you'll use up all your life force on your brain and you'll shrivel up your uterus. You won't be able to have kids like you're supposed to do. Well, they used their science smarts when they finally, allowed them to get them to say, no, that's not the case. That's not really true at all.
As I read the last chapter of the book, I have to say, I did feel sad because it felt, some of the women go off and they have happy marriages. As you said, one was known out lesbian, but it's entirely possible that others of them were partnered. But they seem to have run into the same sort of conflict between home life and professional life that we still really haven't solved for women today.
It was very rare for women working in any profession at the time, like even up until, oh God, maybe even the 40s or 50s. I'm not sure. Don't quote me on this, but I know well for way longer that women, if they were working, they were expected to quit if they got married, right? This was just a societal thing for a very long time. And in the Victorian era, for Elizabeth Garrett Anderson to be married, to be performing surgeries while pregnant, to have 3 kids at home and to continue practicing as a physician, this was totally unheard of. To have a partnership where both adults went to work at the beginning of the day and came home at the night, and they spent spare time together. That was not how you did it at all. And this is what we know now, but that her marriage was revolutionary at the time. It's many women felt like they couldn't get married while they were doctors. They couldn't be a good doctor if they were married and had kids. But other women made it work. They really did. And there were a lot of lesbians in the sciences and medicine at this time. And they were very happily partnered. Some of them adopted kids. Emily Blackwell adopted a kid. Elizabeth Blackwell adopted a kid. So they were parenting, making time for it. Did it work all the time? Probably not. I know you probably had to have a lot of money, just as you do now. There was nannies involved and wet nurses, for Elizabeth Garrett. It's not like she was doing it alone. Her daughter talks about how she didn't really like babies and loud noises and things like that. So she liked her kids when they got a little older. I think a lot of women can relate to that. Babies aren't for everyone, but yeah, it's fascinating to see how we're still having these problems, that just for how long we've been having these discussions. That was such a big reason why men were like, oh no, you can't be a doctor. What if you're like called out for a call in the middle of the night to go tend to a patient and you're pregnant and you go into labor or something like that? They were convinced that there's no way women can make it work having a relationship, having kids, and having a job. So we've been fighting about this for so much longer than I had any idea we were.
So let me ask you a couple of questions to wrap up. The first is, as you think about this experience of becoming immersed in the lives of all these women, are there any lessons that you take away sort of to apply to your life as a writer, as a professional now, of their determination, their sense of themselves, their inability to back down? What are they inspirational to you?
Definitely. I mean, their curiosity and their tenacity, like everyone was telling Sophia Jex-Blake that women weren't involved in medicine, women weren't scientists. And she went into the library and was like, that's not true. And she got all these books and she wrote all these essays about how all the women healers that were in Egypt and the Middle Ages and throughout. So she was like refused to accept anything at face value, right? So like doing your own research, being very curious, being determined to prove people wrong. Yeah, no one would blame any of these women for stopping at any point on this journey. I wouldn't know about them if they had stopped, right? We wouldn't have them kept in archives. We wouldn't have their things preserved. But absolutely no one could blame them for quitting at any point in their journey. It was so hard for them, and to look back and see all that they went through and think of how hard it must have been on them, in those moments. And to see them not only, continue on that path to achieve their own goals, their personal goal of getting that MD, of being, starting to practice, of being a surgeon, being a good doctor, of elevating the practice of women's medicine. But they didn't stop there. They said, okay, this isn't just about me. I have to make sure that everyone who comes after me, all these other women, can do this without facing all that we faced. And so we'll set up all these schools. There's so many schools that they set up all over the world, and this one in London especially, it's the first women's medical school in the UK. It was the only place women could study for many years. And so it wasn't just that they were thinking about themselves. They were thinking about everyone else at the same time, making sure that all those doors that slammed shut, that they said, okay, we're going to make our own door now.
So the last thing that I want to ask you is, you are working on another book, and it's about another brave group of women. And I'm wondering if there's anything you can tell us about it.
So my imprint has already purchased my next book, which is very, very exciting. It is about 4 women physicists escaping Hitler's Germany. 2 of them are Jewish and 2 of them are not. But one of them, her love interest is Jewish, her boss also. So yes, I'm jumping to a very different time period and a different discipline for sure. So I'm big learning curve on physics. I'm hoping I can make physics as accessible and entertaining as medicine was in the first book. But yes, these women are fascinating. There's some really harrowing tales here. So many of them lost siblings to the Nazis, and many of them were also almost, put in concentration camps. They're, narrowly avoiding things, being interviewed by the SS, and, getting on trains covertly, crossing borders, that kind of thing. So there's some intrigue and all that good stuff. But I have a photo with 2 of these women sitting with Einstein and a couple other men, and it's like, we know these men's names, we don't know these women's names, but there they are, right there with Einstein. Like, what? I want to know what these women too. That women are making discoveries and doing cool things at the same time.
And another set of unappreciated women to discover. Does the book have a title and a date yet?
I'm not sure if it has a date yet. It's called A Flame of Hope, because all these women are, except for one of them, is a flame spectroscopist. So their specialty was also their spectroscopy. So yes, it probably, I think it's due in like 2 years. So it'll be after that. 3 years.
Okay.
See it, I don't know.
We'll all put a note in our planners to check back in 2 years. In the meantime, Olivia, I can't thank you enough for spending this hour with us. So this is just a fascinating conversation. Thank you everyone for listening. On behalf of the Emory Center for the Study of Human Health, the Emory College, and the Georgia Center for the book that we've been talking about is Women in White Coats by Olivia Campbell. It was published in March by Park Row, an imprint of HarperCollins. You should buy it. It's amazing. Thank you all for attending on behalf of all our sponsors. And I'm Maryn McKenna from the Center for the Study of Human Health. And we hope to see you in our events next semester. Good night.